Well, good afternoon, everyone, and welcome to today's webinar entitled NAA's Mental and Emotional Health Survey, Challenges Facing Today's Workforce. My name is James Campbell, and I'm the Senior Manager of Industry Relations with NAA. And I want to welcome all of our members in attendance. Thank you for joining us for this important topic. Before we get started, I want to go over a few housekeeping points. First, this webinar is being recorded and will be posted to our website and YouTube channel next week. You may then share this webinar with those colleagues and friends who are unable to attend at present. Next, this webinar is an open discussion where you're encouraged to ask questions throughout. Simply type your questions into the Q&A or chat boxes on your screen, and then towards the end of our presentation, we'll share them aloud with our speakers. Oh, pardon me. Now I am pleased to introduce our host, John Sons. John is Director of Training and Marketing Strategies for Burlington Capital Properties, where he has worked for 20 years. Previously, he held property management positions at Colonial Properties Trust and Walden Residential. John is CALP certified and serves on the faculty of NAAEI. He has also chaired the Diversity and Inclusion Subcommittee on Education at NAA, as well as the Operations Subcommittee on Mental Health. John?
James, thank you so much. As you mentioned, I am chair of the Mental Health Subcommittee from which all these mental health initiatives have originated this year. And I just can't begin to tell everyone how excited and grateful I am to see all these things take place and come to fruition. And it's been a true team effort. And you're going to hear from some of those people that have helped put these things in place this year. Today, you're going to hear from three expert presenters. Jen Picotti, Chief Leasing Officer from Swift Bunny, who helped us conceive, develop, execute, and analyze the survey we're going to be talking about today. Gene Supin, Senior Consultant with the National Council for Mental Wellbeing, who helped review this survey and will help educate us on what the National Council is all about and how they can help our NAA members in this increasingly critical area. And Gene will be joined by Jeremy Adderman, Director of Business and Strategy for the National Council, who will be providing us with best-in-class programs from the National Council starting next year. So we're super excited about all the information we're going to be sharing with you today and what's yet to come next year. So to help get our presenter started, however, I wanted to briefly give you a sense and an overview of how these efforts evolved. The NAA Subcommittee on Mental Health was originated, it was in its infancy stage this year of 2021, after years of talking about what we could do for our members as it relates to mental health. Let's face it, we all have mental health, right? It's either good mental health, unfortunately poor mental health, or somewhere in between. And we know that the industry, the apartment industry, is a stressful industry. It has been from its inception. So now we're going to be talking about those things and what we can do to help our members. And as the subcommittee formed, one, we wanted to talk about our targeted demographics, which I just described as everybody, right? Everybody has mental health. But we wanted to talk about three main topics: making the conversation comfortable. And when I say that, I mean letting our employees be able to discuss their mental health issues with their supervisors or with their colleagues, making it a comfortable conversation. Us and them, by that I mean our on-site, our property management employees, and how they interact with the residents and the residents' mental health. So keep in mind, we've got the employees' mental health, and they interact with all of the residents' mental health. And that's a lot to shoulder, and that's a lot to take on. And there's a lot to be said about that. And then dealing with trauma at the properties. So we wanted to dig into those three talking points, and we wanted to gain some industry-specific insights and in helping make the conversation comfortable. And that's when we asked Swift Bunny to be a partner. Actually, it was a mutual conversation, if I can be completely honest, with Joe Bailey and myself one day at breakfast in Augusta, Georgia. And we decided that one of the best ways to gain insight was to do a survey. And that's what we're going to be talking about today. And then one thing that just really excites me, and I get goosebumps every time I think about it, is we're finally engaging with mental health expertise. We have expertise now that is part of our organization. They're partnering with our organization so we can help our members, and that's the National Council. And again, you're going to be hearing from Gene and Jeremy a little bit later. And now to present the findings and implications of our survey, it's my pleasure to introduce Jen Bacati. Jen, take it away.
Thank you, John. I appreciate this introduction, and we're so excited to be a part of this conversation because we're really living in an incredible time right now, aren't we? There's so much happening. We are seeing so many changes. We're facing so many new and old challenges in our communities, in our personal and professional lives. And while there's a whole lot that we can be frustrated with, there's also so much that we are grateful for, because we are seeing and hearing so many more open conversations about topics that have been taboo for generations. And not only are we seeing and hearing these conversations, we are experiencing the solutions-focused conversations, which I think is so, so critical. And this study is focused on one of the topics that we are finally being able to be more candid about, and it's so timely. So there are so many gold nuggets that came out of this study, but we only have 1 hour. So I'm going to be focusing on some of the key findings. And I know that one of the reasons that you're here is because this is a topic that is really important to you. And so I want to let you know, please know, before we wrap up, you are going to have access to downloading the entire study so that you can dive into all of the details. So let's go ahead and dive right into that. We were very, very pleased with the level of participation in this inaugural industry study. It's the first of its kind in our industry. We are so excited about that. And the results that you're going to hear reported on today are based on 2,332 respondents. And for those of you who are a fan of stats, this gives us a margin of error of plus or minus 1.8% and a 95% confidence. In other words, this study provides a really strong representation of our industry. So you can feel good about the fact that this is representing what the people that you're working with, who are working for you, who you're working for, this represents all of them. So the survey itself consisted of 12 positive statements, and we asked respondents to evaluate how much they agreed with the statement and how important that statement is to them. And our survey process at Swift Bunny uses this unique two-pronged approach because it's not enough to just ask someone, how satisfied are you with something, or how much do you agree with something? I need to know how important is that something to you so that we can really hone in on what matters most to you. All of you in your companies, you have limited time, you have limited resources. So we want to focus your attention on what's going to have the greatest positive impact on the largest group of employees. So that's what this process is all about. So in any one of my executive review sessions with companies, I always like to start with the greatest success. And these are the things that work, what's working best, what's working well for the respondents. The way that we identify successes and opportunities is tied to the topic's agreement and importance score. And this is a score that's between 1 and 100, and it's based on Swift Bunny's proprietary algorithm that takes several things into account, some of which include the agreement score of the topic, the importance score of the topic, how much it correlates with an employee's likelihood to remain with the organization in the next 12 months. So we use all these factors, and this goes into that score between 1 and 100. 100 is the highest score any topic can achieve. 1 is the lowest score. So when we look at the results of this particular survey, the reality is that there was no standout topics that we could really label as successes. But what I do want to do is focus on a topic that earned the highest AI score, and that is this one. I rarely feel stressed about my interactions with team members. So this topic earned a score of 75 out of 100. And you'll see that the overall level of agreement on a scale of 1 to 5 averaged out to be 3.74. You'll see that in blue at the top of that chart there. The overall importance averaged at 4.49. You can see there's a disparity there. Importance is significantly higher than the overall agreement. Now, the columns that you'll see, the blue columns represent the level of agreement, and the green columns represent the level of importance. And this distribution shows the percent of respondents who responded a certain way on that scale of 1 to 5. So a response of 1 signifies a person totally disagrees or it is totally unimportant. An answer of 5 indicates that they are totally in total agreement or it's totally important. So for this specific topic, 64% agree or totally agree with this statement. It earned a low correlation with the employee's likelihood to remain with the company. But what's really interesting to me about this particular topic is the breakdown by position. So respondents, when they took the survey, they identified themselves as one of 7 positions. And you can see that along the bottom. We've got corporate acquisitions and development, corporate operations, corporate support services, regional operations, on-site management, on-site leasing, and on-site maintenance. Here's what's really fascinating to me. Notice the level of agreement in blue. It's pretty consistent across all categories. And the reason I find this so interesting is that this pattern is very unusual, particularly in this study, and you're going to see this in just a moment. But what I also want to point out is one of the main reasons all of the people involved wanted to create this survey is due to all of the crazy things, the level of burnout and stress that we're seeing among rental housing employees right now that are attributed to so many of the things that we're up against: the pandemic, inflation, crime, supply chain issues, all of these different things, so much more. But when it comes to feeling stressed about interactions with team members, this is a tale as old as time, folks. This is an evergreen issue. It doesn't matter if it's today or if it's 5 or 10 years ago or 5 or 10 years in the future. No matter what the year, no matter what the economic situation, the staffing levels, et cetera, leaders can set an expectation of healthy and acceptable, timely communication. What is acceptable in your organization? What is unacceptable in your organization as far as how we treat each other, how we speak to each other, how we work together? So think about providing training on communication, on conflict resolution. And I know that we've been seeing more on this topic of de-escalating emotionally charged interactions. I know we're seeing a lot of training that's being provided there. So here is a quote that is an example of one of the thousands of comments that we read through the course of this survey. And it's representative of a lot of comments that we saw related to this particular topic. This person said, "We need support from higher ups. I'm not allowed to email them, and I have so many questions." So whether it's needing an answer to a question, whether they need approval, whether they want to express frustration with a process, a policy, or a coworker, leaders can clear the path and reduce stress and frustration by setting the tone, setting the internal expectation, and the support of how your company communicates both internally and externally. So now we've set the stage on how this information is laid out for you. We've covered the highest scoring topic. Remember, the highest score was 75 out of 100. So now I'm going to dive into the topics that scored the lowest. And I call these the greatest opportunities for improvement, because these are really the topics that impact the greatest volume of respondents and can have the greatest positive effect if we address them. So remember, we're going to be providing the full study to you. So I'm going to be painting with really broad strokes as we go through these key findings. I'll be highlighting what really stood out to me the most and what employees are asking for. So let's go ahead and dive right into the deep end. The first topic we want to talk about is overall, I feel less stressed than I did a year ago. This received a 56 out of 100. Frankly, this was really surprising to me that it got the lowest score, because thinking about the uncertainty that we were all faced with, that we collectively faced a year ago, and to know that many respondents report feeling even greater levels of stress now, this was surprising to me. And maybe I was naive. I guess I was naive about this whole thing. But in fact, when we look at this statement, overall, I feel less stressed than I did a year ago. Only about 36% of respondents agreed with this statement. Nearly 45% disagreed that they're less stressed. So let's look at how the different position categories responded so you can see the differences now. Here's where we see the different experiences overall. We've got corporate support services that showed the highest level of agreement, and regionals and on-site managers showed the lowest level of agreement. They're saying, I am more stressed out now than I was a year ago. And this is a message that I'm seeing consistently across all employee engagement surveys over the last 6 to 9 months. Community managers have been maxed out, they are burned out, and now we're seeing regionals showing signs of that burnout as well. So the following quote is really representative of comments that we saw again and again throughout the results. We have been understaffed since August, and my manager is brand new too. I am carrying a workload out of my job title with no extra pay. I often use my lunch break, if I have time for one, to cry in my car from stress. Now, this isn't just one of its kind. I saw many comments similar to this, expressing that level of frustration, that level of burnout, that level of stress that people are carrying around right now. So the Great Resignation, it is real. And trying to fill open positions, as you all know, it's incredibly challenging right now, but we can't keep having the same level of expectation for a skeleton crew as we do for a full team. It is simply not sustainable. And so leaders can take a hard look at what is the current level of requirement? What is the current level of expectation? We can press pause on some things. We can streamline other things. Because maybe offices have been open historically 7 days a week, 8 a.m. to 6 p.m., but maybe that's not realistic anymore. Do we really need 5 different versions of the same report? Who's looking at them? Who's making decisions based on those reports? Let's be real about those things. Is a 5-day turn actually possible with your current maintenance staff, or are we setting them up for failure? What internal support can you provide or even promote, make it more visible, so that your team, they might not even be aware of some of the support and resources that you currently have in place. So those are some places that leaders can start too. So let's take a look at the next opportunity. In the last month, my mental and emotional health has not interfered with my personal life. Over 40% disagreed or totally disagreed with this statement. It also ranked second in overall importance in that list of 12. So really high importance. You can see that green bar on that chart right there. But what also captures my attention is the time frame that we're talking about in the last month. So think about this. In any given month, 40% are indicating that their mental and emotional health has indeed interfered with their personal life. And let's look at this as how this is affecting the different position groups. Notice that the highest agreement score is it tops out at 3.51 out of 5. That's from on-site maintenance. And if we look at the other end of the spectrum, we've got on-site leasing and on-site management, 2.79 and 2.81 respectively. And here's how one respondent summed this up. I feel like only being given the weekend is not enough time to de-stress from all that properties handle. Even having the weekend off, people are catching up on getting things done for their own lives or families. It doesn't feel like you truly get time to de-stress. So, let's be real. This is part of being a working, functioning adult. We all have to, deal with our personal lives and get things done. That's a reality. But I saw a quote from Adam Grant recently that I feel really spoke to this particularly. And he said, burnout isn't due to a lack of motivation. It's caused by a shortage of capacity. Our teams want to do well. They do. They want to do a good job. They don't want to go in and do a bad job. No one wants to go in and do a bad job every day. But what I saw from many of the results of this survey is that I think we've got a serious shortage of capacity. And I don't think that's a surprise to anyone who's on this call at all. What it requires, however, is a commitment from our leaders to decrease unnecessary requirements and free up some of that capacity. Easier said than done, but it's something that we really need to take a look at. And this leads to our next opportunity for improvement.
Hey, Jen, just real quick, I hate to interrupt you, and
No,
this
go
was,
ahead.
but I've had a couple of text messages come in, and already people are surprised with what you're sharing. Could you repeat or revalidate when this survey was taken? I think they're surprised that this was taken at the end of this year. So I've had a couple of text messages. I thought this would be appropriate to reiterate when we did this survey.
Yeah, we conducted this survey, and I'll refer to Doug Miller, who really was instrumental in writing and conducting the survey. But this was this fall, September, October timeframe.
Yeah, so this
Very, very
is
recent.
this year. This is a recent survey. So I hated to interrupt you, Jen, but I've had
No, this is
text
good.
messages, and I thought it'd be appropriate to mention that now.
Yeah, thank you. Thank you for bringing that up. This is very recent. This is hot off the presses. So this has just happened in the past couple of months where we've gathered this information. So very good point. And when we talk about this, I rarely feel stressed about my workload. This topic ranked third lowest in agreement. This is at the bottom of the list when it comes to agreement. But interestingly, it also ranked among the lowest in correlating with the likelihood to remain with the company. So this seems to indicate to me that the negative attitudes about work-related stress are expected, or at least accepted to an extent. So while this topic might not be a primary driver of why someone would leave their job, it's definitely a contributing factor, and it's something that we can influence. It's something that can be addressed. And let's look at the position breakdown and see who's really affected here. Operations, I hear you loud and clear. Both corporate and regional operations are sending up a red flare. I mean, they really are. And on-site managers and corporate acquisitions and development are close behind. So one thing I would challenge you, no matter what level of people leader you are, when is the last time that you asked your team, what's the greatest obstacle that you're facing in getting your work done every week? It's an important question to ask because the answer may be really surprising to you. Some of the things that I've been hearing from employee engagement surveys just over the last few months is approval levels, having the appropriate approval levels and not having to get a bottleneck of, okay, I'm waiting for this approval. Response time from support departments, slow or outdated technology, internet connectivity. Even in this day and age, internet connectivity is causing challenges. But you can't do anything about it if you don't ask. This is a great question to ask. What is the greatest obstacle in you getting your work done every week? Some of the solutions may be way easier or way less expensive than you think. And here's a comment that we read over and over and over again. Some iteration of this over and over again. Stop introducing something new every month. We need a minute to breathe. And I think that sums it up perfectly. So let's take a look at what's next. The demands of my job rarely interfere with my personal life. So remember when we could just tell our employees to leave their personal lives at the door? We asked them to compartmentalize work and personal issues. So guess what? The genie is out of the bottle on that one. It's not going back in. And guess what else? The genie was never in the bottle to begin with. We just talked about it as though it was. So the pandemic allowed us to talk about and talk openly about the integration of our work lives and our personal lives. So when schools and daycare shut down, and when people were bringing their aging parents out of senior care facilities and into their own homes because of COVID outbreak, we were forced to acknowledge that employees had critical responsibilities outside their defined company job descriptions. And when it comes to those personal critical responsibilities, those are going to trump job responsibilities any and every day of the week. That was our reality. And what did you do? You got creative. Online leasing, maintenance YouTube videos. Managers were working from home. Kids logging into school from their community centers. We got creative, we made it work, and business, it continued. we did make it work. So the opportunity that we have as individual companies and as an industry overall is to really recognize the success that we had, recognize what the workforce was able to accomplish responsibly and reliably. And we need to consider some of those emergency measures as potential new normals. We need to be willing to look at that, because the reality is that a lot of our employees are no longer willing to let our work override our personal responsibilities. So we've got to consider more opportunities to implement things like flexible work schedules, like part-time options, more hybrid options, because that is what the current workforce is really demanding out there. So let's look at the position breakdown. Regional operations, they're really expressing the greatest challenge with job and personal life interference. And remember, these are the ones that are expressing the highest level of burnouts right now. It's taken a while. It's gone through the on-site community managers, but now we're seeing it hit really hard with the regional operations folks right now. And corporate operations and on-site management, they're really close behind on this one. I don't think it's a shock to anybody that these are the positions that are impacted the most. And so we have the greatest opportunity to be creative with these roles in particular. It's something that we really have to be willing to look at. The issue is coming to a head. We can't deny it. We can't ignore it. And I think this quote really represents many that we saw in similar veins. Property managers worked more than anybody during the pandemic and got nothing from it besides stress, burnout, and anxiety. We got no extra time off, no time to be with family and care for them. We were expected to put them to the side and carry all the burden. We saw this type of quote over and over and over again, sometimes referring to managers, sometimes referring to regionals. But we saw this type of thing. We didn't get anything but stress and burnout and anxiety. So from an industry perspective, it's an issue that we do have to address. If we're going to find or hire or hold on to people leaders at all levels of the organization. So let's take a look at what came next. In the last month, my mental and emotional health has not interfered with my productivity at work. Once again, I encourage you to take a look at the time frame. In the last month, 29% disagreed with this statement. So that's nearly 1/3 of our employees out there. That's a pretty big deal. So how much opportunity do we have as companies, as an industry, if 1/3 of our workforce is less productive in any given month due to mental and emotional health? This is a real opportunity. And this is a dollars and cents issue that we really need to, I think executives in particular need to pay attention to. Address the needs of address the needs of your team, increase productivity, you're going to grow the bottom line. And one side of me really hesitates to even bring that side of it up. But the bottom line is that the bottom line will speak to certain leaders, and that will be the thing that moves them to action. So address the mental and emotional health need, and you will increase profits. And let's take a look at who's most affected. On-site management and on-site leasing. These are the ones who impact directly the day-to-day experience of our residents. These are the ones who are leasing apartments. They are ensuring the operations of our communities are taking place and running smoothly. They're generating the renewals. They're keeping the communities full, and they are collecting the rents. So they are the ones that are struggling the most when it comes to the impact of their mental and emotional health on productivity. And this is a quote that really brought it home for me. Yes, there is stress and workload issues. They're juggling work life and they're juggling home life. But there's another side to this that's unique to the pandemic. Some of us are grieving a teammate's loss, and it is difficult to manage at times. On top of everything else. Let's not forget that grief is playing a bigger role in any individual's emotional health than ever before. whether it's the loss of a coworker, a resident, a friend, a family member. Think about this. Many people, many of us have seen more loss in the last 2 years than at any point in our lives. So that is layered on top of just the regular stress of everything else that's going on. Let's be mindful of that. We can't turn our heads away from it. We have to face it and recognize that. Okay, so this takes us to the last of our top 5 industry opportunities, although it's ended up being top 6 because we've got a tie. But let's take a look at it. Kind of appropriate for my state of mind here. I feel emotionally well. What I find interesting about this is that while 17% disagreed with this statement, we got nearly 32% who were in the neutral zone. They gave a response of 3 on a scale of 1 to 5. They either don't know or they don't want to say. And I find that that speaks volumes in and of itself. And when we look at the position breakdown, again, we see the lowest average agreement coming from on-site management and on-site leasing. These are our most customer-facing employees. So what an opportunity. We can listen to the collective needs and begin to offer next steps. We can have more open conversations. We can have more encouragement of PTO and mental health days. We can have more evaluation of workload and job requirements and job expectations. Because here is the reality that many respondents shared. As someone who's been diagnosed with a mental health condition, I do not feel it would be accepted if I were to need a day off due to my mental health. When I have a need for a day off for this, I have usually come up with another excuse that would be more accepted. I don't think I would be told no if I were to tell the truth, but stigma surrounds it. And I think that is a very real reality. So let's talk about the amount of time that's taken off due to not feeling emotionally well. If you look at the top line of this table, this shows that the overall results, and out of the 2,332 respondents, 39% said that they had taken time off for this reason. That's 909 employees. 12% of them took a week or more. That's 280 employees. Out of 2,332, they took a week or more off due to not feeling emotionally well enough to do their job. So this isn't physical illness or injury. This isn't taking a vacation. This isn't caring for a loved one. This is specifically for not feeling emotionally well. And let's take one more step to really connect all the dots, because this, in my mind, is what it boils down to. How likely are you to remain with the company in the next 12 months? This is a leading indicator. This is asking the respondent, put yourself a year from now in your mind. Can you picture yourself staying with the current company? Now, 73% indicated that they were likely or very likely to remain with their companies. 8% indicated that they were unlikely or very unlikely. But then we've got this 19%. The 19% who are unsure or unwilling to say one way or the other. That's 1 out of 5 employees. 1 out of every 5 of your employees is not sure or not willing to say if they're going to remain with the company over the next 12 months. These are our movable middle. These are the ones who are most likely to be influenced by the changes that you can personally impact. So while there's a lot to digest on these key findings that I've gone over today, there's a lot more to digest when you look at the overall study. But the main point that I want to share with all of you today, all of you who took the time to be a part of this conversation, to look at these results, we can positively impact an entire industry by taking next steps in our journey. And every journey begins with one step. And we took a huge one as a group collectively by even conducting this study. And so I am really excited to turn our focus over to Jean and Jeremy, who will share the next steps that we can continue on on what will be available based on the results of this study. So Jean, tell us what we've got to look forward to.
Thank you, Jen. I'm Jean Supin with the National Council for Mental Wellbeing. But Jen, first, we rehearsed for this, and you have been so incredibly articulate describing survey results as we've been going through them over the past week. But today, by talking about the grief, by revealing your own emotions, you just made it so real and so vivid and so empathic and passionate. And I needed to say that because I too started to tear up as you did. And it's rare when listening to hard data to also really remember that we're talking about people, and people with strong experiences and strong emotions. So I needed to start with that by just thanking you. So I'm with the National Council for Mental Wellbeing. The National Council is a trade association. It's been around for 52 years. We represent community mental health and substance use treatment providers all over the country. These are, for the most part, the larger provider organizations in your communities that, again, provide a full array of mental health services, addiction recovery services, and other similar supports around mental well-being. We've been around for decades. I've been affiliated with the National Council for 22 years. We have just about 3,500 member organizations, again, all across the country. And those member organizations serve 10 million children, adolescents, young adults, seniors, families in your communities. As you can see on the screen, our vision is to make mental well-being, which is thriving regardless of a mental health or substance use challenge, a reality for everyone. More specifically, what we have done for, again, 5 decades, is we sort of have 3 buckets of work. We do capacity building within the mental health and substance use world. We provide consulting to our provider organizations. We provide training. We provide technical assistance within the mental health and substance use industry, so to speak. And then we also advocate on behalf of our members, advocate at federal and state and local levels regarding public policy, regarding rates, regarding service design. And then we also provide education, training, consultation to other organizations such as NAA, where we sort of bring our expertise and the expertise of our 3,500 member organizations to other organizations that are eager to learn more about mental health, mental wellness, addiction recovery. So, and as you can see, we've accomplished a lot over the 5 decades. We have over 1,500 discrete technical and clinical technical assistance programs that we offer. We have secured, just in 2020, $4.25 billion from the federal agency, the Substance Abuse and Mental Health Services Administration, to administer and improve mental health and substance use recovery services across the country. And then and I'll talk a bit more, but we also have a state-of-the-art program called Mental Health First Aid that we offer to companies and communities and individuals all across the country. And we have trained over 2.5 million people in mental health first aid. And then we, similar to you, we have our own annual conference that usually hosts about 4,000 to 6,000 people. So that's sort of an overview about the National Council. And what we know in our work just to reiterate what you are experiencing within NAA, these are sort of national statistics across all industries, but mental health, substance use, mental well-being are huge issues in the workplace. So just a couple of really quick, statistics. 10.8 million full-time workers have a substance use disorder. As many as 200 million workdays are lost each year due to mental health challenges, and fewer than 10% of employees, when surveyed, feel that their workplace is free of stigma around mental health. And again, these are national statistics across all industries, but as Jen described in the survey, you're experiencing that in unique ways in your organizations as well. So this relationship really started several months ago with a cold call. John Sons and James Campbell reached out to the National Council just by cruising around online and finding us. And I was lucky enough to get tagged to meet with them. And we very quickly connected on so many things. And the National Council was, when we were approached, and still are, really, really excited to be able to build this partnership. James and John have said from the beginning that they really see this as a long-term relationship and a long-term partnership, and to allow us to bring our expertise around mental well-being, around substance use, around mental health, and bring that expertise to you so you can feel better equipped to ease stigma, to talk about these issues more comfortably, to recognize when you're feeling particularly stressed or having challenges, when others you're working with are experiencing challenges, to be able to know kind of how to help. So we participated, we had lots of conversations about what this might entail. We have met with the mental health subcommittee. We contributed what we could to Swift Bunny's fabulous survey, and we are now poised to take those survey results and work with NAA and work with the mental health subcommittee to figure out what expertise we can offer to provide support. So a couple of things, and Jeremy's going to talk, my colleague Jeremy's going to talk a little more specifically, but again, we have mental health first aid, which is a national curriculum, and we also have mental health first aid at work, which is specific to a corporate setting. We also offer training and support in a zillion different topics related to mental well-being. And then we hope to be able to, at various ways, link you in your local communities with our members in your local communities, so there can be some partnership there. So I'm going to pass it on to Jeremy, who again is going to provide a bit more detail about some of our offerings.
Yeah, thanks, Jean, and thank you all. I mean, thank you, National Apartment Association. Thank you, John, Jen. Thank you all who are on the line here for showing up and engaging. I think it's easy, this topic is easy to sort of write off and say, it's difficult for everyone out there. It's what are you going to do though, right? It's a challenging time, but here you are, just by showing up, saying, we can do something about this. We can and need to do something about how to take care of ourselves, the people in our lives, whether that is coworkers, whether that is tenants, whether that is friends, family, loved ones. The first thing I want to just quickly highlight, mental health first aid. For those of you who are not familiar with mental health first aid, it's a course that was actually developed in Australia, and the National Council brought it over to the US about almost 20 years ago now. The easiest way to understand this, it is CPR for mental health. It teaches folks, all sorts of folks, anyone out there, how to recognize the signs and symptoms of mental health and substance use challenges in the people around you. Again, that could be your friends, your family members, your neighbors, your coworkers, your children, any group of people like that. And just like in CPR, the first thing you do when someone's experiencing a cardiac crisis, you call 911 and then you administer a CPR services. Same with mental health first aid. This is not about becoming a therapist. This is not about becoming a behavioral health provider. This is about first understanding the signs and symptoms, helping to connect people to potentially life-saving services, and then how to support them, how to even have a conversation with them about these things. So mental health first aid, we have a number of different types of curriculums, as Jean mentioned. There's the more what we call adult mental health first aid program for adults. There is the youth version for adults that work with youth or young people. We now have a teen version for teen peer-to-peer type of training. And we have the at-work version, understanding that the workplace has its own uniqueness about how to have these kinds of conversations, about what resources are available to you, whether it's your EAP, whether it's your HR program. So that mental health first aid at work training also comes with some additional training for the corporate environment, knowing that there is not just about training people to identify these things, but a culture shift at every organization that is needed to welcome people in, to invite people to say, we can talk about this openly, we can be honest with ourselves. So that mental health first aid program, we're so passionate about it. We've trained actually close to 3 million folks to date. We'd love to talk with you all about bringing mental health first aid to your communities, to your organizations. Next slide. And then real briefly here, the National Council, we actually had gone by the National Council for Behavioral Health for almost the entirety of our 50 years of existence. And only in the last year did we go through a pretty significant name change to say we're now the National Council for Mental Wellbeing. And that's a significant shift, because that is really recognizing and understanding that it is not just about supporting those with mental health and substance use challenges. It is about promoting well-being for all people, regardless of if you have a mental health or substance use challenge, but for all people. And so some of the things that we provide training and support on speak to that. These are things that aren't necessarily about having clinical depression, although it may be about that, or maybe about clinical anxiety, but it may not be. It may be about stress or experiencing the global trauma that we are all experiencing today. So a number of trainings and supports the National Council provides on a number of different levels in a number of different modalities. Again, I won't speak to all of that, but it's something that the National Council, again, can provide and is willing to provide in any way that we can be helpful. I think now I'll turn it back over to John.
Wow, I sitting here, like Jean said, we've rehearsed earlier this week, and I didn't know what to expect during the webinar as it related to emotions, and I've been overwhelmed. I'm glad my camera was off. I've been overwhelmed with emotions a little bit during the webinar. I've seen some great questions come in, some text messages have come over my cell phone, and but I want to thank Jen and Jean and Jeremy for the insights that you've given us, the information that you've given us. I also want to thank Doug Miller. Doug is on here. Doug was, I think he would freely admit he was the nerdy, geeky guy behind the scenes, making sure that this was just a thorough and accurate survey. So I do want to thank him. But before I tell you about some exciting things to come, I do want to invite you to feel free to make questions or comments in the chat box. We've all agreed to be here as long as you need us today. This is scheduled to be an hour. We still have a few minutes to go, but we've all agreed prior to today's webinar to stay here as long as you need us to answer questions or field comments that you may have, because this is such an important topic. We are in multifamily, and a dear friend of mine, Pete Regulus, recently won the Lifetime Achievement Award, NAA Lifetime Achievement Award. And he talked about us being a family, and I can see the folks that are in the room today, the participants, knowing who's registered. We are a family, And we've always been an industry that has cared about one another. And it's time that we dig into something that's really passionate to all of us, whether it's comfortable to talk about or not. And we do want to talk about it. You're proof of that today because you're here. So as I tell you about those exciting things that are on the horizon for us, please feel free to put your comments or questions in the Q&A, or I'm sorry, in the chat box, and we'll get to those in just a few seconds. So what's to come? First, with the ever-changing pandemic and everything that we're facing nowadays, we want to be sure that we keep on top of the state of mental health in our industry. That is why we're pleased to be rerunning our survey in March of 2022. We have a baseline survey now, and we're going to run it again in March of 2022. Our goal is to be rerunning it on an annual basis thereafter, so we can see how our industry is progressing against the benchmarks that the survey has set. That will be interesting to see if there are any, and I'm sure there will be changes in some of the information that Jen went over with you earlier today. And I want to add this. Jen and I spoke before today's call. I was watching the Today Show this morning, and LinkedIn was talking about some 2022 forecast in the workplace and the predictions for 2022. And mental health was the very first thing they talked about. And one of the things that they talked about was being able to reach out and asking for that help. So I thought that was interesting that was on today just before our scheduled webinar. Some other things that's coming up second, as some of you may know, May is officially Mental Health Awareness Month. So we want to schedule 3 webinars from the National Council during 1 week in May, featuring the hot topics and best-in-class presenters that the National Council will be bringing to our NAA members. So be looking for that. That will be Mental Health Awareness Week in May of 2022. And then third, we plan to pilot test the National Council's best-in-class training programs, mental health first aid at work. I'm super excited about that. More than 2.5 million people have been successfully trained in these programs over the years, so look for details to come on that. We are also working with NAAEI. We've had some brief conversations about how the National Council and our partnership can interface with more educational opportunities for our members as it relates to mental health. Apartmentalize. We are just super excited. I'm super excited that we're going to have, we had 2 proposals accepted for next year's NAA Apartmentalize Conference in San Diego in June. One session will feature Jen, again, providing updates and more in-depth analysis of our survey results, how that second survey compares to the first survey. For those of you that don't know, and I don't mind telling you, I am a mental health patient, and you'll hear a bit of testimonial from myself about my mental health journey on a personal note, and as it relates to our industry, how my personal life and my professional life are intertwined, and why mental health is so important to me. And the other session will feature Jean and another expert from the National Council on how to recognize and address issues of distress in your workplaces. So again, we're super excited about those sessions. The first one is scheduled for a morning session on Thursday at Apartmentalize, and then Jean's session is scheduled for that afternoon on that Thursday in San Diego. So I know we've covered a lot. There's been a lot of information, a lot of eye-opening information, a lot of important information. And now we want to know, do you have any questions? I know that we've had some questions asked, and I'm going to try to get to those. And in no particular order, how do you discuss mental well-being with the owner of your property because it has a stigma? How do you approach that topic without sounding like the staff is broken? Who wants to fill, I may throw that to Jeremy or Jean. I don't mean to put you on the spot with that, but we knew we'd be put on the spot with some of these questions. What are your thoughts about how do you bring up mental health to an owner or even an upper level executive that thinks there's a stigma attached to that?
There, I was going to get Jeremy, you want to take it first?
Sure. So, I think the first thing is acknowledging that there is a stigma around mental health, unfortunately, at the moment. And I think coming from a place of understanding of challenges that are being faced. You know, I think there's a defensiveness that often happens when you bring up issues of mental health or mental well-being. And so it's around, and this is part of the mental health first aid program, around sort of coming from a different angle, not coming from a place of right around mental health, what mental health challenges are you looking at, but how are you feeling? What is happening in your life? You know, slowly moving towards a conversation around mental well-being without starting from a place of mental well-being. Jean, what would you add?
And I would also add that oftentimes it's not necessarily that a leader isn't empathetic or sympathetic, or, you know, doesn't believe mental health challenges exist. Oftentimes it's worry, I don't know how to respond to it as a leader. And so just keep that in mind as well. As Jeremy said, don't necessarily talk about just what you're going through. And sometimes it's helpful to just reassure whoever your boss or an executive leader, just reassure them. And I'm not looking at you to help me or fix it or even know how to respond. But it's just important that I can be able to talk about this.
And, you know, if I could piggyback off that, you know, if you go back to some of the initiatives that the mental health subcommittee had for this year, was making the conversation comfortable. And I want to back up just a little bit when we were talking about having a mental health subcommittee. And some folks wondered, well, is there something else we could call it besides mental health? And my response was quick and immediate. And for those of you that know me know I'm pretty blunt with my responses every now and then. I said, whoever's asking that question should probably be the first topic of conversation, because you don't want to call it what it is. We're talking about mental health. So it's a conversation. But we need to make it a comfortable conversation. And Jean said some things there. I know that I have interacted with folks that understand it's important, but they don't know how to respond. So perhaps for those of you that understand that it's an important conversation, but you're uncomfortable about having that conversation because you may not know how to respond, you're probably one of those that need to do a little bit of research and self-education on how do you respond. We're not here to provide clinical assistance to our employees. And I think you all need to understand that. We're not here providing clinical help, those of us that you see on the screen, but we're here to help you provide resources. And part of that is self-education on how to listen, and then how to respond. And sometimes your responses, while they may not seem, the intent is not for them to be hurtful. If it's someone crying out for help, it could be a hurtful response if you're hearing the conversation but not listening. So that there's a lot to be said to that. We got a lot of questions. I'm going to try to go through those. Have you seen properties moving to or allowing a 4 10-hour day? That's the 4-10 schedule. Jen and I spoke about that this morning. That was mentioned on the LinkedIn predictions for 2022. They expect more workplaces to go to a 4-day, 10-hour a day work schedule. Jen, do you have any comments? Because I know we talked about that, and I know y'all have done some other surveys. Anything you want to speak to as it relates to that?
You know, I haven't seen it become a big part of the conversation. I think there's, as with so many different initiatives in our industry, there's a lot of wait to see who's going to do it first. So I think there's a handful of companies that may be trying it here and there. But what I would encourage the conversation to be among leaders at your company is looking at what are our options? What amount of flexibility can we start talking about? Because you know how hard it is to hire people right now. It's not necessarily going to resolve quickly. And we know what people want. They want flexibility. And when there's this hard stop against, well, no, we can't do it that way. Why not? I mean, let's get into it. Why not? And I think those are important conversations that need to start happening more frequently. I think they are happening behind the scenes, but so far we haven't seen very many people who are really leading the charge yet. I saw recently that there's some companies that are moving to all virtual. for tours and things like that. And I think everyone's watching these companies to see how is that going to go. So start the conversation and challenge the norms, because the fact of the matter is that is what the workforce is and will be looking for. So I'm glad you posed the question.
Don't be afraid to ask questions. You're not today, you're asking great questions. Don't be afraid to ask the questions and come with possible solutions on how to make the mental health environment at our workplace easier. I mean, there's a lot, Jen went over some results in that survey. We've asked a lot of our on-site team members, especially over the last going on 2 years now. I'm going to continue with some questions here, but while I continue with the questions, I would invite everybody to go into your chat box. There's some great resources in there. There's a white paper link that's in there. There's other great resources that are in that chat box. So please feel free to peruse that chat box. And James, while I'm asking the next question, is there a way that we can gather some of these things that are in the chat box here and perhaps make those available? I know that we're recording this and we'll make this available at a later date, but can we include some of these resources people are providing in the chat box? You're muted. I thought that.
Sorry about that. Yeah, great point, John. I will absolutely accumulate these, and we'll see about posting it to the web page. The page where you can download the white paper, that's where we'll accumulate the resources. And also, one of the people, I think Lisa Kaminsky, asked, how can we be part of the pilot test? On that same web page, you'll find a link to my email address. If you have interest in participating when we finally work out the details, let me know, raise your hand, and we'll make sure to reach out to you first. So that one all-purpose web page with the survey results, I think we're going to start building that out and making that an all-purpose resource of this webinar content and chat content.
Okay. We had a question here about making this, someone loved the webinars. They appreciate them. We're glad. Thank you. We love that feedback. It does take a lot to put these together, and we hope that they're helpful. And they spoke about CAM, continuing education. It struck me when you typed that question about CAM. We're actually in the midst of rewriting the CAM course right now, and I think it's only appropriate that we perhaps visit, and I'll bring this up when I'm at NAA next month regarding the CAM rewrite. Maybe it's appropriate that we include some type of mental health within the CAM course. I think it's only appropriate to do that. But remember, I said earlier, we're also working with NAAEI on how we can incorporate our partnership with the National Council on furthering the education opportunities to our membership. So the best way to answer that question is be on the lookout for more information to come. We're working hard on that, and we're working on a toolkit or resource kit for you. Going down through here.
Actually, John, there's a very interesting question from Janet Moline. How can we get certified in mental health first aid? Well, she's reading our mind. We actually are contracting with Jean and her crew. Not only are we going to have mental health first aid at work, but there's a follow-on to that, which is a train the trainer program. I think it's called Mental Health First Aid Instructor Trainings, and we'll be pilot testing that as well. So maybe perhaps Jean and Jeremy, if you want to speak to that particular program, there seems to be interest here.
Absolutely. With mental health first aid, the important thing here is that we want to help bring this important curriculum to everyone in the country. We would love it if everyone had this as part of standardized training, whether it is in the workplace, in the education system, whatever it might be. So we do employ a train the trainer model. We have something close to, I think, 14,000 trainers, instructors across the country. We have quite a bit of instructors across the country who bring training, again, into their community, into their employment, in their place of work. So we would love to talk about the train the trainer model. You can also look at our website if you want to learn more about mental health first aid, mentalhealthfirstaid.org. Great site. We're really happy with it. So yeah, excited to be talking about this.
Now, I have begged and pleaded to have the first reservation spot for that mental health first aid training program. I don't know if I'll get it or not. Someone may beat me out, but I'm super excited about it. And I know there's a lot of trainers attending this webinar today, and there may be a lot of trainers that watch this rerun of the webinar. I would encourage you to get excited about it. It's a way for us to help our industry by being trained on such a topic. I'm bouncing back and forth here, looking at questions in both the Q&A and the chat. I've got one here from my dear friend Kara Rice. John, are there any successes you've had at Burlington with regard to your team's mental and emotional health? Well, there's one I'm pretty proud of. Very early on in the pandemic, back in 2020, when we were all trying to figure out what in the heck's going on, what are we doing, how do we navigate our way through this? I don't know where the idea came from, but I started a Thoughtful Thursday within our company, and every Thursday morning, the entire company, from the founder of our company to the CEO, chairman of the board members, C-suite, corporate employees, accounting, finance, all the way through the property level, we would get on a call every Thursday, stop what we were doing. And the call had no agenda. And when I told the CEO, she asked me what it was about. I'm like, well, there's really not an agenda. She said, well, you don't have to have an agenda to have a purpose. And she was really, really right. We started every Thoughtful Thursday with, how are you doing? Just how are you doing? It was a Zoom meeting. We all got on here together. We stopped what we were doing and just, how are you doing? And I have to be honest, I was moved at how responsive and how open people were on those Thoughtful Thursdays. And I was even more moved when after they were about an hour. They were an hour. After the Thoughtful Thursdays, there were times my phone would just ring off the hook, employees wanting to talk about their situation and their emotions. Emotions are real. We're all human beings. And you don't know what you're going to read or what you're going to hear or what you're going to talk about. Jen was a perfect example of that. I thought I was going to be the one showing my emotions today. And it's real. And I think that helped a lot of our employees. We got a lot of great feedback from that. We went from every week to every other week to now we're once a month. And people just really have embraced the Thoughtful Thursday, and it's just getting together as a team and showing that we all care. So I don't know if that's what you were looking for as far as an answer, but I think what that did, even if it, it's hard to know what it was doing during the Thoughtful Thursday, but I can tell you after the Thoughtful Thursday, the phone calls that I had with people after that had an impact. And we have some mental health resources that we share with people. And I know that those have helped folks, and they found that to be useful. So, all right. So let's see here. Am I missing? I know Doug and James, you're kind of helping me. Phil, we've got so many great ideas. This is just wonderful. All the ideas that are in the chat box. If you've not had a chance to look at these, we've got a white paper. There's a link to a white paper. James and Doug, I know you're not on camera, but you've got your mic available. Have I missed anything?
No, I think you're caught up, John. And I think to your point about Thoughtful Thursdays, I think we might get questions after the fact.
Yeah.
I think this is something people are going to have to digest and really take personally. And I suspect that we'll need to have some means of keeping the dialogue open here. So
be on the lookout for those webinars. Go ahead and plan to attend the sessions at Apartmentalize. Be on the lookout for the next survey that we're going to be doing. Remember, this is just a start, and I'm so proud of the team's efforts, and I'm so proud of each one of you, all the participants. You're part of that team making this important. Even though you were here to listen and watch today, you're an important part of the process because you care.
I think John, too, one person asked, will this be posted so that our team can view it after the fact? And the answer is absolutely, and I'll talk about that in a moment. We will post it to the YouTube channel. And I think one of the earlier slides had contact information for Jen, for Jean, for Jeremy, even for you. So I think when this thing is posted, maybe we can even do that, just put our own email addresses in the chat so that if anyone wants to follow up with any individual presenter, they can do so on their own.
So I'm going to tell on myself a little bit. I do have notes to keep me on track during a webinar. I always do, but I've lost my notes. I think it's time for me to pitch this back to you, James. Is that correct?
I think so, John. Great job. NAA has its own breadth of resources under the general category of operation solutions. You're absolutely welcome to view this under various topics. And I think the mental and emotional health, mental well-being, with John's pioneering and with able support from Swift Bunny and from the National Council, we'll be building out this particular page. Right now, we just have the mental and emotional health survey, and it's accessible via our operation solution page. But if you click that link, what you'll see is something like this, and you can scroll down to the bottom to download a copy of the white paper. You'll be able to view an on-demand broadcast of this webinar, and we will make it a point to continually add additional resources to this and build this out over time. In addition, we maintain all of our webinars on demand on our YouTube channel, so you're welcome to bookmark that and to view everything that we have to offer. So again, I wish to thank everyone for a really remarkable presentation. Jen, we can't thank you enough. Just the insights and the practicality and the application. I don't think there's anyone in the industry who could have done what you did in terms of the synthesis of all this amazing data. And of course, your colleague, Doug Miller, for putting this whole survey together as well. The two of you are amazing. Jean and Jeremy, we are so grateful to have your outstanding organization and your individual strengths and experience in this field to be made available to our members as a invaluable resource. Yes, we do perceive this as a long-term relationship, and we're very much looking forward to a very productive partnership. And we couldn't have done this all without John's sons. You know, John, all of this I started in his head about a year ago, and he worked with a volunteer group to make all this stuff happen. So John, you know, we, on behalf of the industry, we thank you for your leadership in this. So, and of course, we thank everyone who joined in and attended the webinar. We value our membership and we appreciate your attendance. So to all, have a great afternoon.
Thanks, y'all.
Thank you, everyone.
Thank you so much.